It's a great question, and it's a pertinent question because fever is predominantly an inherited disease. We still don't know all the genetic mutations. About 40% of the time, genetics will show a positive correspondence to a gene mutation. The downside of gene therapy is it's very, very tailored treatment. So it's gene specific at this point. Now, there are some new technologies with CRISPR, which may be a little bit more robust at having these highly tailored therapies, but they're a way out. What's a better treatment, which is more universal so that it's more mutation ambiguous, is something that can regenerate the retina. And there are a couple of regenerative therapies being worked on. Our group is working on one that's in the preclinical manufacturing stages. And then also Boehringer Ingelheim is working on one as well that's in a phase 1 trial for macular ischemia, not for fever. And those are going to be probably the first types of meaningful therapies to restore normal retina in fever patients.
Yeah, I think in sort of talk about it with sort of a broad brush. I think, as Dr. Drenser is saying, there are multiple genes that are recognized to cause fever, but even within multiple genes, there can be multiple different mutations. And genetic fixes are usually tailored to that specific mutation of that specific gene. So it's almost the kind of thing where every person requires their own kind of boutique genetic fix. And that's impractical. It takes millions of dollars to come up with just one genetic fix. And even trying to fix, a mutation in one gene, all the variants within that one gene just is impractically expensive in terms of both time and dollars. The other challenge to a gene fix per se is that I think our understanding of the genetics of fever is starting to come to a greater appreciation of the complexity of it, and that is, it's not just that one gene alone that's probably essential, but not doesn't explain all the variations within a given family. There are probably other genes that are not quite yet recognized that come into play as, I guess maybe you can think about them as chaperones that kind of chaperone the primary gene and impact on how the disease manifests itself and so forth. So it's complicated, I guess, is the simplest a way to do it. And as Dr. Drenser says, CRISPR technology offers an opportunity to kind of pull genetic material out and put in the right stuff. But other than that, kind of conventional gene therapy, like you're hearing about for other diseases like the RPE65 mutation of Leber's congenital amaurosis, that's a very, very, very specific targeted therapy, and the uniqueness of that target as being, the single gene for that particular type is what allows us to do gene therapy on that. But absent that kind of really tight focus, it's too big a thing to go after with conventional gene therapy currently.
Yeah, and I'll just add, actually, it's a great, glad you brought up the Luxturna for the gene therapy for Leber's congenital amaurosis. And I have a lot of patients with LCA that don't qualify for that gene therapy. So it's a very, very narrow window. And that's the downfall or the pitfall of gene therapy, is that it's so specific that the majority of patients don't qualify for it. So really a universal approach is going to be much better for the majority of these patients. And as I think a lot of people know, we've been doing a lot of research in not just fever, but in all the genes and better understanding them. And as technology is improved and increased, and our panels have improved and become more sophisticated, and we've updated some of this genetic testing, what we found is exactly what Dr. Capone was just saying, which is that we see multigenic hits. So there's a degree of complexity, and it's quite possible that just fixing one gene isn't going to fix the whole problem, because there seem to be some other factors that play into it. So what we've really been focusing on is trying to understand, is there an overriding pathway that we can turn back on to basically override the deficits causing fever in the first place. And if we can do that, then we actually probably have a meaningful therapy and intervention.